So far, we have seen how exact vascular territories look like. ACA territory supplying the superior frontal gyrus and part of middle frontal gyrus. Then the MCA clearly forming a wedge-shaped margins with the ventricles, part of middle frontal gyrus, inferior frontal gyrus, predominant basal ganglia, and the lateral aspect of frontoparietal lobes. And the PCA territory supplying parts of thalamus and the posteromedial aspects of temporal and occipital lobes. So these are the classic territories that we have seen. So what are these marginal zones? Marginal zones or border zones are nothing but the areas which are falling in between these two territories. So whenever you are looking at any case, if you see infarcts either in the anterior periventricular or posterior periventricular like a straight line at the ventricle level, in the superior cuts it will be a straight line in the centrum semiovale level. These areas, they are not in the ACA or in the MCA, but they are falling exactly in between these areas. These are called as marginal zone infarcts, and it is very important to identify the marginal zone infarcts. The reason is marginal zone infarcts occur when there is a severe narrowing of the underlying major arteries or in case of cardioembolic phenomena. So we'll have a look at why it is so. Let's look at an analogy. Let's say the brain is supplied by vascular pumps, and each of these vascular pumps is supplying some area of the brain. And in a given scenario where there is an occlusion of one pump or similar to occlusion of one artery, now what will happen? The area which is supplied by this particular artery will not get the blood supply, so that it will undergo infarction. Whereas in another case, instead of complete occlusion of the artery, let's say there is a severe narrowing of one of the major arteries. Now what will happen? Because of the severe narrowing, the flow has significantly reduced. As the flow is significantly reduced, now the vascular territories, all these pumps, they are trying to supply, but they will not be able to cater to a larger area. Now, the areas which are farther away from any of these vascular pumps are the areas which will be devoid of blood supply in the beginning. So they will show restricted diffusion. So when you see restricted diffusion in the marginal zones, that indicates that there is some significant narrowing in one of the major arteries, and so that it is not able to cater to the distant most areas. That is the importance of marginal zones.